Our next topic could be a huge step for boosting fertility. A common drug used for chemotherapy has been found to help produce more eggs in women's ovaries, possibly indicating a solution for low fertility. And Dr. Farrah, I'm going to let you explain this, but scientists at the University of Edinburgh studied ovary tissue samples from 14 women who had gone through chemotherapy and compared them with samples from 12 healthy women who hadn't gone through chemotherapy. They actually found that the ovary tissue from the women who had been treated with this drug with chemotherapy, they had more eggs. They had
It's really shocking.
Healthier ovarian tissue, you could almost argue.
And it seems very promising, too. I think it's still really early that we're really trying to figure out how the mechanism works. But, you know, we used to be very concerned, and we still are, about women undergoing chemotherapy, especially at a young age, because most chemotherapy is designed to attack cells that are rapidly dividing.
Right,
and
that's why you lose your hair.
Exactly. So that includes, you know, your ovaries and your testicles. So those cells in your body are at risk. So usually those women would try to do something to preserve their fertility or freeze their eggs. So this is really, really interesting research.
Counterintuitive.
It is counterintuitive. And what's interesting, though, is that what they're noticing in these tissue samples is that the ovarian tissue that has a lot of these, more densely packed eggs, we don't know if the eggs are normal because they haven't been exposed to chemotherapy. Some of them, one egg has 2 nucleus in it. So there are some things that they can tell about the eggs that may not necessarily lead to a healthy baby in the future, but it's promising.
And this is one particular chemotherapy agent, ABVD. We're not talking about chemotherapy in general. This is typically used to treat Hodgkin's lymphoma. But we do oftentimes in medicine find these secondary benefits.
Effects.
Exactly.
And then that drug ends up being used primarily, like Viagra, is being used so many different things now.
Exactly.
So right now, this was a study where we don't know what we don't know what to do with it quite yet. I'm curious if, in reading about this, if women who've undergone chemotherapy with this agent, are they then potentially more likely to become pregnant?
Yes. So that's been, there have been corollary studies to show that women that have had Hodgkin's lymphoma, been treated with this regimen of chemotherapy, have actually gone on to have healthy, normal pregnancies, sometimes with fertility help, but sometimes completely naturally on their own. So it seems like that something does make sense, that there is some evidence there. We just haven't figured out how to make that link.
So very interesting.